We all know that this nation faces an opioid addiction crisis, and we're beginning to learn as well that many people become hooked on narcotics after being prescribed pain medications. But now a doctor in New City, New York, Dr. J. Korngold, is teaming up with a martial arts sensei, Gary Moskowitz, to offer a natural alternative. Dr. Korngold is prescribing martial arts therapy, which, he says, releases chemicals in the patient's body, chemicals that naturally fight the pain.
Basically, endorphins, or any kind of pain medication essentially is a synthesized endorphin. We make our own, if you will, our own pain-killing medication inside our own body. In other words, and we can harness that by working out, but we want to do is we want to harness that by basically a person doing breathing and movement. In other words, if you really think about it during the course of your day, how many times do you really properly breathe? How many times does a person really take a deep breath? And really to heal, what do we need? We need oxygen. Oxygen is basically, we need it to live, we need it to heal. So if a person is breathing and doing circular motions, we are electromagnetic basically creatures, and by drawing in some of these kind of electromagnetic fields with circular movements and breathing and meditation, a person really is on their way to healing themselves without the need for opiates. And that really is kind of really one of the core principles that we're trying to get across to people.
Sounds to me like we're replacing here a negative addiction with a positive one.
That's exactly right. In other words, to quote Sensei Gary Moskowitz, in other words, it's a
positive addiction.
It's a positive addiction. This is something that, again, a person could do lifelong. We want to try to introduce it very early and really give a person an alternative, because really at the end of the day, opiate addiction is a dead-end street.
Sensei Moskowitz says there's another aspect to all this. This kind of therapy, he says, puts the patient in control.
Is that I'm not a medical doctor, however, I've been studying martial arts for over, 46 years, and doing a lot of kinetics and pain management skills as part of training, because when we get hit, it hurts, so we have to learn how to control our pain. But I would say, in addition to endorphins, which is a natural opioid in the body here, when we do certain movements, and we attach it to a martial setting, which is talking about safety, it's empowering, and people produce oxytocin, they produce dopamine. There's natural neurotransmitters here that makes us feel good. These are feel-good chemicals in our brain. We're achieving something, we feel good. So you got these natural endorphins getting you on a high, helping you kill the pain. You have these feel-good things, I'm accomplishing something. Before, slowly, just go in slowly, good. I'm moving slowly.
Korngold and Moskowitz are hopeful that other doctors will follow their lead, when possible, offering their patients alternatives to addictive medication as ways of fighting pain. I'm Gary Baumgarten reporting. If you like this video, please share it with your friends and subscribe. There's more good stuff to come.